I think, the situation in Ontario is probably one we're familiar with in terms of declining hospitalizations. But I do think that when I start to look at some of the underlying data, there are some of the initial warning signs of what we might be headed for. And I think a good reminder that while tomorrow is going to be a nice milestone where a lot of the measures and a lot of the restrictions we've had are going to disappear, it doesn't mean the pandemic is over. And I think we'll need to remain vigilant to that. So I'll start off here, as I often do, taking a look at the Ontario case curve. And, we had the restriction in testing starting around the start of the year. Nonetheless, we have seen the group who is still able to get tested continue to go down. But you can see right here at the end, we do seem to maybe be starting to see some evidence of flattening out in terms of our infections. We'll have to see if that remains the case, but there is some sign that at least that group who is allowed to get tested, we are seeming to see a bit of flattening out there. This is actually reflected when we look at our percent positivity for testing. So that orange line here is the percent of tests that are positive. And you can see that that seems to be kind of plateauing out a little bit now as well. And I also just want to highlight that we're still seeing about 10% of tests come back positive, which is higher than we had in any previous wave and higher than we were really for the entire pandemic until the Omicron wave hit. And I think that is notable that that does imply that there's still a fair amount of infection going around in our community. And I don't think we should be ignoring the fact that the pandemic is continuing on. The earliest sign, though, even earlier than we would see test confirmed cases go up, is going to be wastewater. And this is what the Ontario Science Table has put out in terms of what they're seeing with the wastewater trending. And you can see we kind of flattened out in mid-February. And then actually just around the time that we started to reopen further last week, the preliminary trend seems to be that there is more COVID-19 being detected in wastewater, implying that there is now more transmission of infection going around, which will likely be eventually presenting in terms of our cases probably flatten out, which I showed you we're maybe starting to see signs of, and eventually might lead to hospitalizations. If we break down the wastewater trend down to the different regions of the province, we can see it's actually a little bit different across the province. You can see here in Northern Ontario, they never really saw their COVID virus in wastewater come down. It's really remained fairly high all along. But I think what's more critical is sort of the areas nearby us. So we're the Central West region here. And you can see we have an upwards trend in our region. We've flattened out in terms of infection or in terms of COVID being detected in wastewater. And now we're seeing evidence it's going up. The GTA is going up. Eastern Ontario, so just east of the GTA, is going up. Central East, which is the area north of GTA, and that's going up as well. So it does look like, at least in our neighborhood of the province, we are seeing from wastewater that infections might be about to start to go up. Definitely there's evidence that transmission is going up. These are all, of course, the early indicators. Hospitalizations, which is I think where we're going to be most worried about, are going to be a lagging indicator. And for now, at least, the hospital numbers are still coming down, and likewise the ICU numbers in the province are coming down. But we should also be mindful that they're coming down, but they are not down yet. If we look at that hospitalization number, we're still higher than the first or second waves. We're fortunately a little bit lower than the third wave at this point. And even our ICU numbers remain quite high across the province. So I don't think we're necessarily out of the woods yet. And what the science table modeling from a month ago showed is that, yeah, we would see a decrease in hospitalizations for a while, but eventually we might see it, plateauing or increase coming back up. Now, we fortunately seem to be doing better than this green line. We're in the lower end of what was predicted, which is really good news. But I think we're maybe starting to see the infections and the transmission in wastewater start to plateau and go back up. And we might, in the coming weeks, start to see those hospitalization numbers go back up. And I think we need to be very focused on that and make sure that we're able to respond to that if that happens. This is what the science table predicted. If we look at Public Health Ontario, they put out their analysis of what was going to come and outlined 3 scenarios and really highlighted this as the most likely scenario, which would be we have a plateau at a moderate to high rate of transmission of COVID-19. And I think that seems to be maybe where we are headed when I look at the data. Give you the quick overview of what's taking, sorry, and just highlighting as well before I move on from that, is that of course, when hospitalizations, if they plateau and go up, we'll sadly start to see more persons unfortunately dying of COVID-19. For the moment, we are seeing that getting better, though, there's a little bit of slowing down of that coming down as we can see here. So, we obviously want to see infections and hospitalizations come down, so we're not going to see as many people dying of COVID-19. Switching over then to the Niagara trends, it's actually very similar to what we're seeing provincially. So definitely the downwards trend in cases amongst the group who can be tested, but some evidence that now we're starting to flatten out in terms of the number of cases that we're detecting. And remembering, of course, cases are only a subset of people who can be tested, and the true number of infections is much higher, and I expect much higher than the first or second wave still. When we look at percent positivity here, this is a Niagara trend where you can see we've actually flattened out in our percent positivity here at around 15% or so. So there is some evidence that maybe infections are definitely flattening out here. And of course, this percent positivity is much higher than in any previous wave of the infection for us. Wastewater trend in the Port Weller plant. We can see here that, lost my pointer for a second, apologies. We can see here that we did see a downwards trend in terms of our wastewater, but there is some evidence that we are flattening out here as well, which I think consistent with some of that other data that I showed you. When we take a look at outbreaks, which is another measure that I've been paying attention to here, the idea being that if we're seeing fewer infections in the community, we're going to see fewer infections in the long-term care homes, congregate settings where we're monitoring for outbreaks, and we should see probably a decrease in that. And fortunately, we're seeing that for quite a while. We do seem to be flattened out in terms of the number of outbreaks, which again, I think would be consistent with infections kind of flattening out right now in Niagara. Hospitalizations, though, are looking much better for now. ICU numbers likewise are on their way down, and even the subset of COVID-19 hospitalized people, the ones who are being treated primarily for COVID-19, are trending down. But of course, the risk is that we're going to see the plateauing out of infections maybe start to present in hospitalizations in the coming weeks going forward. Just taking a look at hospitalizations a little bit differently. So this number here is a total number of people currently admitted to Niagara Health. If I actually take a look here at the number of new hospitalizations per day, averaging that over 7 days, this is a metric we have on our website, you can kind of get a sense here that we are flattening out, and flattening out at a level that is relatively high, maybe halfway of where we were in previous waves. And I'm just going to zoom in on this bit here so we can see that data a little bit more clearly. And I think you can get a sense that the number of new people being hospitalized every day has really kind of flattened out, which I think would lead to eventually we will find that our hospitalization numbers are going to flatten out, because if we're seeing the same number of people every day become hospitalized, we're going to kind of eventually hit the steady state there. And being mindful that when we look at our hospitals in Niagara, they are still over capacity right now. They are beyond 100% capacity, so they have not been able to recover yet. And when we're looking at deaths from COVID-19, we're fortunately seeing fewer deaths and more days where we're not seeing deaths reported, but we are sadly still seeing people dying from COVID-19. And this isn't a situation where we were maybe back in December, where deaths were fewer and far between. And so we definitely do want to see those infections come down. I emphasize that hospitalizations are really going to be, I think, the key thing that we're going to need to see going forward. I think the province's reopening is predicated on hospitals no longer being overwhelmed, and they're hoping that hospitalizations won't come back up, even if we do start to see infections transmitting more as we lift restrictions in society. I think that can come true if we have enough people vaccinated out there, so that even though people are getting sick from COVID-19, they're unlikely to be severely ill, need to be hospitalized, or worst off, end up as one of these persons passing away from COVID-19. We're still making progress on vaccinations, though it is slow at this point. These are our first doses. Blue here are our second doses, and then the green are the booster doses. We've definitely had really good progress on the 60 and up population, who is greatest risk of having a severe outcome. But we do see people in their 40s, 50s getting hospitalized, and even occasionally people down in their 30s or even their teens. And so we absolutely do need to get the booster dose numbers higher for these age groups. And I would really like to, of course, see vaccinations get higher up for the 5 to 11 population to make sure that they are well protected too, and that we're not seeing infections transmitting from kids over to perhaps their parents or grandparents or uncles and aunts who might be more vulnerable. Of the adult population, we have had a lot of good progress. We have 57+% of them are vaccinated with a booster dose. We're getting pretty close to 2/3 of people who at least have any vaccinations have their booster dose. So definitely the majority of people are boosted in our society. We just need to make sure we can close this gap down. So the difference between booster doses and second doses looks a lot more similar to that second to first dose difference going forward. We are seeing far smaller numbers of people coming to our vaccination clinics. You can see we're down in the kind of 1,000 range these days, which is much more similar to where we were before the Omicron wave and before we had the big booster dose campaign. And I'm hoping that people really take to heart the message that with provincial measures being lifted in most public places, we can no longer rely on those measures to keep us safe, and we're going to be much more reliant on personal behaviors and the vaccine to make sure that we are safe. And hopefully people will take that message to heart, they'll get vaccinated, and we can minimize the risk that when we do see infections go up in the coming weeks, we won't see that followed by the hospitalizations and deaths. Hopefully. One interesting thing to note is that when we look at our vaccination protection, we could see here we're doing very well with the vaccine preventing infections for most of last year. The Omicron variant eroded that. We had a sharp drop off, and with booster doses, we brought that back up. This was probably actually a combination of booster doses plus people changing their behavior so that vaccinated people who, of course, got vaccinated because they take COVID seriously, they practiced all the precautions. They limited going outside of the home. They, cut their social contacts. And by doing all of that, vaccinated people actually had a reduction in their risk, and so they're less likely to be infected with COVID-19 because of the vaccine, but mostly also because that vaccine was associated with people who are also practicing more preventive measures. And we can see here, shortly after the province starts to reopen on February 1st, we see a bit of a drop off in that protection. And then after February 17th, we've seen another bit of drop off in that protection. And I think what this represents is that people who are vaccinated are taking signals from the government that it is safe to get back out in social spaces, and they're doing that. And because they're doing that, their risk is actually going up. And so they're seeing some erosion of how protected they are. And that's not necessarily the vaccine eroding, but more actually their personal behaviors and eroding. And of course, people who are unvaccinated probably have not taken the pandemic seriously. They never really changed their behavior, but we are starting to see that vaccinated people are changing their behavior, and that's putting them at greater risk of getting infected. Of course, while they're at greater risk of getting infected, personal behaviors doesn't impact your risk of being hospitalized once you are infected or being in an ICU once you are infected. So we're not seeing any drop off in the vaccine's ability to protect against that. And I think that is the really good news. And hopefully as we get more people with booster doses, more and more people can be up here with that level of protection from hospitalizations to make sure that we don't see that in our society. And we're, of course, going to continue doing our vaccine clinics this week. We are at the Canada One Outlet Mall all this week in Niagara Falls. And we'll start this week today in Wainfleet. We'll spend a couple days in Port Erie and as well in Port Colborne. So running a couple clinics every day this week. And of course, those clinics are, any age can come in for vaccine, and anybody can make an appointment or just walk in. And just to emphasize, if people have questions about vaccines, they're not sure if they want to get a vaccine, they're more than welcome to attend any of these clinics just to actually have a conversation. No expectation necessarily that they even get the vaccine dose, but they're welcome to come and have a talk with us so they can better understand what the vaccine entails, what the risks are, and hopefully inform their decision by actually having a conversation with the public health nurse in person. And so hopefully that's something people will take up with us. Last thing I want to comment on today is around local orders and letters of instruction. I think there's been a lot of conversation around that in the last couple of weeks. And I think I just want to make sure that we all understand what is the scenario we're working under and what is the actual correct narrative, because I think there's some false narratives that maybe have taken hold a little bit. You probably all saw earlier this today, we sent out a media release highlighting that we are backing off from a couple of our orders and our letter of instruction. That is really recognizing that once we saw the provincial regulations, particularly that measures like physical distance are no longer going to be required, these orders are probably not going to really have much effect. It's not going to make a lot of effect for people to take precautions in these settings, but be able to really go about their life in all kinds of other high-risk settings and gatherings where they're not going to practice those precautions, and there's going to be risk of infection spreading. And so it made sense to back off on some of those orders. But to give a little bit more context on orders as a whole, there's been this comment about local orders maybe not being aligned with what the province is doing. And I want to highlight that the province has always articulated that these local measures are part of it. And I don't want to necessarily go back over the entire course of the pandemic, but in our most recent roadmap to reopen, which came out in June, July, as we are reopening after the third wave, this is the deck that the province released around the details. This is back on July 9th. And they highlighted very clearly here that there could be instructions from public health officers provided. And that was really the basis here, that they expected that even with this reopening back in July, we would continue to see local measures tailored to protect from COVID-19 going forward. That plan for reopening was updated in the fall by the province, and they laid out this long plan here, which is really, I think, the same framework we're operating under with the timelines changed. It's a bit confusing, but the idea is they released their plan here in October. We're going to go through multiple steps of lifting capacity limits and the like, and eventually get towards March where everything would fade away. And what they highlighted within this plan is that as the things are lifted, there would need to be a need to respond to any new surges of infections. And they highlighted the response to surges or waves would be public health at the local level using existing authorities, Section 22 orders, instructions under the Reopening Ontario Act to address those going forward. And so that's the reopening plan the province put out in October. That plan was, of course, slightly modified in January, given that the Omicron wave came up. But again, highlighted instructions from public health officers would remain critical for that reopening. And even if we go just a couple weeks ago to February 17th, where they outlined their latest plans for reopening, again, highlighting instructions from public health officers would be some of what is expected from February 17th. And then even projecting out to March 1st, and what are the intended public health measures? They highlight, in addition, local medical officer of health will have authority to apply public health measures in their jurisdiction to target specific transmission risks in the community. So contemplating that even past March 1st, there's going to be a role for a local medical officer of health to issue these local instructions. And if you go to ontario.ca/reopen to see their latest language around reopening, again, they're saying after March 1st, public health units at the local level can deploy responses based on local health indicators. And their media release they did a couple weeks ago announcing this plan going forward had this language around effective March 1st. And again, to manage COVID-19 over the long term, public health can deploy local and regional responses. So it's very much in alignment with the province that we would be doing orders, we would be doing instructions locally to address COVID-19 going forward. It is contemplated and highlighted really consistently over the last 7 or 8 months of our reopening going forward. I just want to zoom in on where we were in the fall for just a second. So this is the Ontario case curve, which I showed you earlier. And you can see here, back in November, we were seeing infections on the way up. And you may remember that in about, I think it's November 8th or so, the province put a pause on that reopening plan they announced in October because they were seeing infections going up, they were seeing trends worsening. And one of the other things the province actually did on November 23rd is that they shared with all of us at the local level an inventory of all the different local measures in place across the province, because they recognized to stem this increase of infections, they were expecting us at the local level to start to think critically about additional local measures to make sure that we could flatten this out, expecting that the winter months might be a very difficult time with COVID-19. And they wanted to give us the list of all the local measures that have been done elsewhere in the province so we could consult with those and decide if any of those actually made sense for us to apply. That was back on November 23rd. I just want to quickly go over actually what we saw on that list of local measures that we were shared on November 23rd. So back on that date, we had 28 local public health agencies who had an order around individuals isolating. We had 26 local orders around sports and athletic facilities. There's 16 on workplaces, 12 on agricultural farms. There were 6 in food establishments. There are 4 in retail. There were 3 that required the automatic closure of workplaces if a certain number of infections were identified in them. There's a couple orders on apartment and condo buildings. There were a couple places that actually had capacity limits that are applying across the entire business economy in those regions because they were seeing quite high numbers of infections. There was orders in a couple of regions on social gatherings. One area put businesses responsible for organized gatherings had an order on them. Childcare operators had an order on them in an area. Faith-based organizations had an order on them in an area. There was one region that was putting an order requiring workplace antigen testing. One area put an order around driving instruction classes. We had one area which put an order on people who traveled internationally. And then there's in one place that had broader infection control measures directed at establishments. So lots and lots of orders there. If you actually add it up, it adds up to over 100. On that date in November 23rd, in Niagara, we had orders in orders actually in these 3 areas here. So in Niagara, we have actually been putting orders in places where most of the province, or at least much of the province, has also similarly believed that there is a need for additional local measures. Of course, shortly after that, on December 2nd, we added a letter of instruction on sports and athletic facilities, so becoming the 27th area to have one of those. And again, we're putting measures in place in areas where there already are many other areas putting those measures in place. And so I think our use of orders and instructions has been very much in line with the province, applying orders not in areas where we are going solo, but in areas where we are putting measures where other regions have likewise seen the need for measures. Just looking at that November 23rd date, 34 local public health agencies had an order or instruction on that date, which means 100%. Every single one of the 34 local public health agencies had some local measures in place on that date. So we are very much part of the consensus across the province that local measures are part of how we are managing COVID-19 going forward. As I mentioned, there was over 100, I think there's 106 or 107 total sets of orders or instructions in place across the province. On average, that worked out to about 3.2 orders were in place in any local public health agency. As I mentioned on November 23rd, we had 3, so very much we were in the norm of what was going on in the province. And in the province, it ranged between 1 to 5 sets of these local measures in place. So with us being 3, we are very much right in the middle of that. And I want to highlight that, when we did our next instruction, which was on sports and fitness facilities, so this was our media release on December 2nd, you may remember that we had this quote in it, which is by Dr. Kieran Moore, Chief Medical Officer of Health, who is supportive of us taking these additional local actions, because of course, local actions were part of the province's plan, and we were acting directly in alignment with them about putting local measures in place. And as I mentioned, during this time, the province is really looking to us to put in place local measures to try and address that upwards trend of infections that we were having. And sometimes the province hasn't just been supportive of us taking these local measures. If we actually go back to the summer of 2020, we had this memo from the Chief Medical Officer of Health advising us to actually issue Section 22 orders to protect employees of temporary workers of farms, basically migrant employees. And this is a quote coming from that memo, recommending Medical Officer of Health use authority under Section 22 to issue orders to ensure employers of temporary workers take actions to decrease the risk of COVID-19 on farms. And so we actually have an order in place on the request and recommendation of the province in this case. So again, very much in alignment with what the province was expecting for us. So, I think there's a narrative sometimes that it's unusual that we're having local orders in place in Niagara. And is absolutely not unusual. That is very much the norm, and we have been the same as every other local public aid agency in doing that. And we have been aligned because the province's framework on reopening has always emphasized the importance of local measures. And in some cases, they have outright supported us with those measures, and in this case, actually recommended we put those measures in place. So very much in alignment with them. As I mentioned, 3 of our sets of orders haven't made sense. So we going forward past March 1st. And so we are pulling them back because we don't think they're going to have any real effect unless they're complemented by broad provincial measures elsewhere in the population. But looking forward past March 1st, I just want to highlight some of the language the province has said. So this is when the province outlined the framework in the first place back in October, and responding to any surges, they said responses to surges would be by local public health using existing authorities, and will vary by local context and conditions. And only if there are worsening indicators provincially wide would the province response need to be considered. So the province did say that with their framework, once they got to the end of the framework and lifted provincial measures, they were putting a pretty strong expectation that us at the local level would really be responsible for dealing with the local surges. And of course, talking here about post-March 1st, Medical Health Authority to apply public health measures in their jurisdictions. Likewise, public health units can deploy regional responses based on local indicators. There's very much the expectation here by the province that orders are not going to suddenly disappear now, and they're going to continue being part of how we respond to COVID-19 going forward. And so we may well see additional orders and instructions in the coming weeks and months, depending on what we see locally in terms of COVID-19. The removal of our orders is really a reflection of the current situation. It's not necessarily reflecting that we are not going to be doing orders and instructions going forward. As of this moment, we don't have plans for any current ones, and we're not currently contemplating any particular additional measures right now. But I think it's clear from what the province has outlined, this is going to remain part of how we need to respond to COVID-19. And so we're definitely going to keep that option open that we might be pursuing that again in the coming weeks and months, depending on how we see the pandemic evolve. And so I'll stop there and turn it over to Courtney to moderate the questions.
Great, thank you, Dr. Hergy. So we will start with Paul, and you should be able to unmute now.
Can you hear me okay?
I can hear you well.
Thanks, Courtney. So Dr. Hergy, some provinces are moving to get rid of even mask mandates. That is something I would assume that you should remain in place for some months to come.
Yeah, I would strongly recommend that remain in place for quite a while still. I've shown you the, the science tables modeling. Public Health Ontario have all said infections are going to start to go back, plateau and maybe go back up as we lift our measures. I think we want to try and limit how high those infections go, because the lower infections are, the lower the number of people can be hospitalized, then the lower number of people are going to be passing away from this virus. And I think we have so few things now left to continue to control COVID-19. I really don't think masks are one of those ones that we should take away. Masks, of course, they're not the most comfortable thing to wear, but I think we've all gotten used to it over the last year and a half. And I think we can have our businesses open. We can not have really any economic impact from wearing masks. So I think it's a sensible, common sense measure that we would continue to keep in place until we can see the risk of COVID-19 much lower. And then we can, of course, look at removing masks. And, I'll just add one other measure that I would wish the province would keep in place would be proof of vaccination, because I think that's another common sense measure. It doesn't inhibit the ability of a business to operate. It doesn't limit, people being able to go to work and earn their income, but it does provide us one additional measure to continue to control COVID-19 while we're still dealing with a fair number of infections, and it can hopefully make sure that this reopening is going to be sustainable going forward.
And a follow-up?
Sure. With these broad measures being rescinded at the provincial level, is it that local order could actually become more important in the coming months, as based on local what's happening around locally?
Are you saying local measures that we might put in?
Local measures. I guess the problem is possibly placing more importance on local public boards, bringing in measures as they are necessary to control any kind of surges, infections.
Sorry, I muted myself for a second because there's a little bit of echo when you're speaking, Paul, and I can let myself lock on mute. So to your question, I think if the province is taking away their measures, they're basically shifting the responsibility for staying safe and preventing COVID-19 both to actually individuals for their individual choices, as well as to us locally to enact local measures. And I think we can see evidence of both of that in terms of some of the language that the provinces use. They're stepping away from this. They're really, expecting at the local, level, we are going to continue to deal with any local patterns, and that individuals will need to make their own decisions around how they keep themselves safe. So we'll, of course, continue to look at what trends we can see here in Niagara, and if there are patterns of spread that make sense for us to address with local orders. But I think the other part is, of course, the public needs to, of course, take the steps that they can individually to stay safe, which means, I think, wearing masks, making sure that they are up to date with vaccinations and that booster dose if they have not yet got it. Now is a really good time to get it because the risk is going to be far greater being out in the community. And I think for people to make their own risk judgments, I think there's going to be people who are more vulnerable, who maybe have a vulnerable person in their family, and they're probably going to want to continue to keep more distance from others, avoid large, busy social spaces where there's going to be more risk of infection. And then maybe some other people are going to be more willing to take on that risk. And we should, of course, be very understanding of people who make different decisions as we go forward, because I think there is different levels of risk for different people, and we need to be understanding of that.
Great, thank you. Up next, we have Penny, and you should be able to unmute.
I'm sorry that I have to ask this because I feel like I really should know it. So as of tomorrow, vaccination proof when people go to a restaurant or somewhere else that it's expected, are they still going to be expected to show that?
Yeah, so starting tomorrow, there is no provincial requirement to show proof of vaccination. So it's really up to the discretion of any restaurant if they want to continue to have that or not. If a restaurant chooses to continue to have that, of course, people would have to show it. If a restaurant chooses not to, they don't. Really want to, state a lot of support for restaurants who do choose to continue to have it. We know this is a setting where people are at risk of COVID-19 spreading, and I think they've taken a really brave stance to make sure they continue to, protect people, protect their customers, protect their employees with COVID-19. And hopefully we can support all restaurants who do opt in and all business who do continue to opt in to asking for proof of vaccination.
And a follow-up?
Yes, you had confused me a little bit when you talked about that earlier, and you said that you're not going to add any extra restrictions at this point, although you might consider it in the future. But you also said, I thought you said that you would support the continuation of vaccination mandates. So you're going along with what the province is doing for now, but considering that you might change that in the future?
Well, I'd say that we're not bringing in any additional local measures at this time because we haven't identified a local pattern of spread or a local area that we need to address spread of COVID-19. I am recommending, not requiring, but recommending, though, that businesses and organizations continue their workplace vaccination policies. COVID-19 is clearly not over. The pandemic is still going on. And I think that's a really sensible policy to make sure workplaces are safe and that employees are going to be safe and able to keep working and not be off sick. And likewise, I'm really supporting any businesses who do want to continue with proof of vaccination. I really think the province should have kept this as a requirement. Unfortunately, they have backed away from it. And I think there's a lot of leadership being shown by some local organizations who are going to continue to have proof of vaccination. And I really want to lend my support and congratulations to them for making that really tough choice, because I think it's a real choice that's going to protect a lot of people in the process.
Thank you. Up next, we have Gord. You should be able to unmute.
Hi, thanks. I guess all the good questions have been asked. I'll ask about some of the mayors came out locally calling for travel restrictions to be lifted. And I know that's a federal matter, but what would you think of that?
I need to hear exactly what they are proposing. I know one issue that has come up is around the testing to travel. And I think actually the testing makes a lot of sense. And I don't think Canada is unique in requiring a test for travel. This is actually universally something that's expected in many countries around the world. I think the federal government did move away from PCR tests towards rapid tests, which I think does make it easier to get a test for travel. And I think that is, sensible measure about maybe, accommodating travel a little bit more. but there's still absolutely risk for people traveling. The Omicron wave is spreading quite rapidly in a lot of countries around the world. And I think we do want to be mindful about the risk of infection continuing to spread. And I think there's, of course, the risk of new variants emerging. And this is going to be important for us to make sure that we stop the entry of new variants into Canada, where people who are traveling might get infected with a new variant, come back. If we can at least identify that they're infected and isolate them, we can stop the spread of those variants before it starts to affect our population.
A follow-up?
Have you seen it? I think it's BA2, isn't it? Or have any of those cases shown up in Niagara yet?
We haven't had a confirmed infection of BA2 variant here in Niagara. It's important to note that the province is only doing genetic sequencing in about 3% of the infections right now. So there's only a limited sample of where we would have picked it up. So it's certainly possible there could have been some BA2 infections, and it's just not one of the ones that ended up being sequenced. So we never really knew. On the whole in the province, we're not seeing a lot of BA2, and the 3% of people randomly selected where they do the sequencing, it's under 5%, I think, right now are coming back showing the BA2 variant. So fortunately, I do think the BA2 is likely rare right now in Niagara. It's mostly the BA1 subvariant of Omicron.
Thank you. Up next, we have Evan, and you should be able to unmute now.
Thanks a lot, and thanks, Dr. Hergy, for a very informative update. I'm just wondering, and of course, it's concerning to see that some of our metrics are plateauing at an equal or even higher level than the peaks of some of the previous waves. Are you worried at this point that in the coming weeks, with restrictions being lifted, we might see a surge in cases, hospitalizations, and deaths in the Niagara region?
Yeah, so I think it's pretty much a foregone conclusion that we're going to see increases in infections and cases. And, I think everybody would accept that that's going to happen when you reopen. And I think the province is choosing to reopen, probably with the full knowledge that that's exactly what's going to happen. And they feel that that is going to be okay. What I think they are hoping is that with the increase of infections, we're not necessarily going to see an unsustainable increase in hospitalizations or a real surge in people dying from COVID-19. I haven't seen any hard numbers, any hard modeling that would really give me confidence that that's actually what's going to play out. The best modeling we had from the science table is that we would flatten out at a relatively high number of hospitalizations over time. And I think that makes me concerned that we are going to continue to see significant numbers of people hospitalized and significant numbers of people sadly passing away from COVID-19 as we go forward. Only time will tell if that actually plays out. Modeling our estimates, they're not, the truth of what's going to happen. But I am worried that that is going to be a scenario that we see. And our hospitals are not going to get relief. They're going to remain stressed. And we could potentially go into maybe the fall where we still have a high number of hospitalizations, the weather cools, infection starts to spread more, and then we start to see a really bad increase in hospitalizations going forward. The one thing that I think we can do to hopefully avoid that is, of course, to get vaccinated. If more people are vaccinated and have that booster dose, the risk of people being hospitalized goes down, and that will be the one way that I think we can hopefully realize the hopes of the province that we'll see infections go up without necessarily seeing a huge surge in hospitalizations.
And a follow-up?
Yes, absolutely, Doctor. And I know you've kind of answered this in a number of different ways, but if there is a surge in deaths and hospitalizations and cases in Niagara, will we see Section 22 orders?
It's certainly something we would consider very strongly. We'd have to really look at the scenario at that point. What measures could we do, and do we think those measures are going to have an impact? I really hope, though, if we are seeing an increase, it's probably going to be a province-wide increase. I doubt we would see it in Niagara and not elsewhere. Mm-hmm. And I would hope that the province would step in with provincial measures, because I think if we take some steps in Niagara while infections are going up in Hamilton and going in Toronto and Peel, with all the people who are going to be traveling down to Niagara and our really great amenities, in Niagara Falls and the outlet malls and the like, we're going to see the infections end up coming, being brought in from other regions here anyway. And we probably won't be able to control COVID-19 with just local measures. We would need some broad regional measures or provincial measures to control COVID-19. But we definitely look at what makes sense to do locally and act in places where we think it makes sense locally.
Great, thank you.
Thank you. We've now gone through everyone on the list. So if anybody has a second question, if you just want to let me know in the chat, and then I can unmute you and you can ask your question. Okay, not seeing anything pop up in the chat, we'll end things there. Thank you everyone for attending, and we'll see you again next time.